think that broadband will create an umbilical cord for healthcare, as it fundamentally allows us to transport the healthcare delivery system to where the patient is. So I can bring a physician to a patient at a rural community who may need a subspecialist, or I can bring that same physician into the patient's home or work site. The fundamental reality is, in order to do that, we need broadband capability. Sure, I think one of the most critical aspects about broadband capability and its ability to bring healthcare into rural sites, as one example, or the inner city, is the fact that by bringing the expertise to the rural community, I don't have to transport that individual into the urban academic medical center. That allows us to fundamentally bring care more immediately to the patient and therefore be able to diagnose the condition when it's less serious. Number two, the patient doesn't have to travel and expend travel funds to see that subspecialist, which in effect not only saves money, but really is green. And it allows us, if we're going to bring the healthcare into the work site, it dramatically enhances worker productivity, because in essence the patient who now has to go see a physician for their blood pressure to be taken, and it may take 2 hours in the doctor's office, I can now take that blood pressure right where the patient happens to be working. I believe that one of the things that is most critical about broadband is not simply that we can bring the physician to the patient, but in fact we have to bring the physician to the patient, because the exam room needs to be where the patient is, not where the doctor is. Taking a patient's blood pressure where they live and work is a much more accurate and a much better evaluation of what their real blood pressure is than taking it in the doctor's office. Taking a child's pulmonary functions, if for instance they have asthma, in their school or at their home where they are breathing the antigens in the air where they live and go to school, is a much better evaluation of what their airway resistance is than if we take it in the doctor's office.